All right, well, first of all, a big thank you to everyone from the Ocean State Center for Independent Living for hosting us, but more importantly, for the incredible work that you do to help thousands of Rhode Islanders live full and independent lives. I was joking on my way in. I hope to visit here sometime when we have good news to talk about. The last time I was here was when the Trump administration and Elon Musk had shut down the payment system for providers to get reimbursed for their expenses. So we were here a few months ago when that was going on. Now, at least for now, as I understand it, that has been resolved. But we're facing a new challenge today that we're here to talk about, and that specifically has to do with Medicaid. Everyone in Rhode Island deserves high quality health care no matter what, full stop. And Medicaid is one of the foundational pillars of how we get people care and support in Rhode Island. Medicaid is the federal health insurance system that supports more than 300,000 Rhode Islanders. About a third of our state gets their health insurance from Medicaid, including more than half of working age adults with disabilities. So a majority of working age adults with disabilities are on Medicaid. But unfortunately right now, congressional Republicans and the Trump administration have put Medicaid front and center in their plan to cut spending in the federal government. It's the wrong place for them to be looking, it's the wrong priority, and I think what we are aiming to do today is help raise the alarm about how devastating it would be if big cuts to Medicaid went through, so that we can convince some of my colleagues in Congress to think twice. Along with Senator Reid, Senator Whitehouse, and Congressman Amo, I feel like for the last 2 months, every day that we have been home in Rhode Island, every day that we're not in Washington, one of us is doing something about Medicaid, because this is like our number one priority, is doing everything that we can to sound the alarm so that we can protect and preserve Medicaid, because it is so important. And what's going on basically is the Republicans in Congress with President Trump are pushing a tax cut plan that we believe would predominantly benefit the wealthy. And they are looking to pay for those tax cuts primarily by cutting Medicaid. Now, they haven't come out with the detailed budget yet. We're still waiting for the details, but there are some clues that give us a sense of what they're planning to do. And the biggest clue is that they've given a series of targets for the amount of cuts they want from each committee in the House. And the biggest target, $880 billion of cuts, they've given to the Energy and Commerce Committee. Energy and Commerce oversees a bunch of programs, but the two big ones are Medicare and Medicaid. And so if, just to extrapolate, Energy and Commerce has to make $880 billion of cuts, that means huge cuts, most likely to Medicaid, because that's the bulk of what Energy and Commerce oversees. We'll see the specific plan probably in the next week or two, but that's what we're anticipating. And you can also sort of read the tea leaves when you hear Speaker Johnson talking about Medicaid. He says things like, well, Medicaid was really meant to help children and really meant to help, people who are completely unable to work and da-da-da. And there are 20 million Americans who are working age, who are working, for whom Medicaid is their health insurance. And so one of the reasons that we wanted to come here today was to highlight the fact that if they cut Medicaid coverage for working age people and or people who are working, that would still be absolutely devastating, because for many, many people, those jobs don't come with health insurance and they would have no other access to care. That's what we're here to talk about. We want to elevate the stories of people who have a personal stake in this. The other thing that I would highlight, that I try to say every time we do an event on Medicaid, and again, along with Jack and Sheldon and Gabe, we're doing all of it. We've done Medicaid events focused on behavioral health, focused on community health centers, focused on nursing homes, all of it. And the point that we try to make is that if you're listening or watching, even if you are not on Medicaid yourself, you could still be impacted by these cuts because your providers will be impacted by those cuts. So for so many doctors, health centers, nursing homes, physical therapists, occupational therapists, Medicaid is a big part of their income. And if that income goes away, they might go out of business. And that hurts everybody who they serve, not just the people on Medicaid. And so part of the message that we're trying to deliver is that these cuts could really impact a broad range of people. But today we're here to focus specifically on the impact on Rhode Islanders who are working age and disabled, because that unfortunately seems to be what Speaker Johnson may be coming after. So I'll stop there, and I want to again thank all of you for joining. I look forward to hearing from each of you. I have too many papers in front of me, so I don't know if we're doing this in any particular order or not. But maybe what I'll do is, here we go. I'll start with Allison DuPont, and Allison, let you introduce yourself and tell your story.
So my name's Allison DuPont. I am one of those working people with disabilities. I have a degree in graphic design from the Rhode Island School of Design, and I'm currently managing program promotion here at OSCIL and moving into new higher level admin work. I have been a Medicaid recipient most of my life, not because of financial need, but because the condition I have a neuromuscular disease, and the care I need and medical equipment and medical costs are very expensive on their own, more than any family pretty much could sustain on their own. So I was on Medicaid as a child through a waiver that was meant to keep children out of institutional settings so they could stay with their families where outcomes are better. And I continue to be on Medicaid as an adult on a waiver that allows me to work and earn money and not live in poverty while receiving Medicaid benefits. The important part of Medicaid for me is the medical coverage, having insurance that will pay for my treatment, for my wheelchair and mobility equipment and things like that, which are very expensive. The wheelchair I'm sitting in was north of $50,000. And more importantly, Medicaid waiver services pay for the people that help me be independent and stay in the community. I can't do much at all for myself. So without PCAs who are there to help me eat and go to work and get dressed and do all the other things that able people take for granted, I'm stuck at home, and I'm not able to work, and I would be stuck at home or in a nursing home and living on the poverty level income that is set by traditional SSI guidelines.
Yeah. Thank you for sharing. And I think that's a really important point, that for a lot of people, if they lose their Medicaid coverage, they'll instead be on SSI getting worse care, but it's still government insurance. It's just worse. Mm-hmm. Yeah. Oh, well, thank you for sharing, Allison. And where do you work, by the way? And where do you live?
So I live in Cranston, pretty much lifelong Cranston resident. And I work here at OSCIL.
Awesome.
My official title right now is the Program Development and Social Media Manager, but that is going to be changing soon.
Awesome. Well, thank you very much. Christina, love to hear from you as well.
Very nice to see you. Thank you so much for coming today.
Of course.
So I very much echo Allison. I live in Johnston, Rhode Island. I work for Skills for Rhode Island's Future as a supported employment coordinator. Love my job. I actually get to give back to people that have different abilities who want to work. Very much like Allison, if I did not have Medicaid services, I would not be able to have my personal care assistants. They help me every day. They are like my angels. They help me get up in the morning. They help me shower, get ready for the day. And during the day, I get to be a productive member of society. I get to go to work, I get to give back to the community, and then I get to serve on many of the different boards I serve in Rhode Island, mostly to help people with disabilities. I feel that just because I was born with a disability, it shouldn't stop me or prevent me from living my life just as anybody else with an able body. So for these funding cuts to come our way, it's very scary.
Absolutely. No, thank you for sharing. And yeah, I think you make such an important point. Like, this is about allowing people to do the thing, like, to their ability level, participate in the economy, participate in the community. And again, that's something that benefits everyone, right? It benefits everyone to have people working and have people being able to, to really do it all. And so, thank you.
And also, too, I'd like to point out, too, that, a person can become a part of the disability community at any time, unfortunately, because of a car accident or a stroke. So it might not affect somebody personally now, but it could in the future.
Absolutely. So Will, we met in Washington actually a couple weeks ago, and along with his son Andre, and had a very good conversation. So want to thank you again for taking the time to we spoke about Andre and his story, and I would love if you'd be willing to share your story again, because I think it's a very instructive one.
Sure. So my son Andre's story is different from Allison and Christina in that my son has some really significant needs, both behaviorally and medically. He has a diagnosis of a pervasive developmental delay, which is on the autism spectrum. He also cannot speak. He has Behçet's disease, an intellectual disability, hypotonia, a mood disorder. He can be self-injurious, and he has a massive history of trauma from his time, his whole life, where going to school was not easy for Andre, and it was a time when it was, even in the state of Rhode Island, where restraint was used to handle people like Andre in the name of trying to keep them safe. And he had a significant amount of trauma from that. So he actually spent a year and a half at Bradley Hospital. We're trying to get his meds straightened out and get some sort of a program in place. And then there was pressure to get him out of Bradley Hospital, so he ended up going to an agency as an adolescent, and had the same issues in the agency of restraints and whatnot. Ended up back in the hospital for another year and a half, all at about $1,600 a day. And so just the cost savings of trying to keep someone like my son in the community are significant. You're not saving money if he slides back, or if the system slides back to a point where people like him have to be hospitalized, right? So since then he's been in group homes, which he's in a group home right now, which is doing a really nice job. I just want to point out that because of the group home that he lives in, when he became healthy enough to be out back in the community again, he was participating in Meals on Wheels. He delivered flowers, food bank, taking excess food from restaurants and delivering them to the food bank, all on a voluntary basis. So he had all of, he was living a productive life, and then he ran into a serious health issue where he lost the ability to swallow. So consequently, he, has spent like the last year plus in the hospital, 2 months out of the year. We were able to recover the ability to swallow, sort of, by taking off a med that he was on. But he still is very fragile. He's my height, which is like maybe 5'10", and he was 104 pounds. And so he was really in danger of dying to the point where he's now in hospice care. And so, our hope for Andre is that he's able to recover his health enough to get back out into the community, but that takes a robust system in place.
Yeah.
So all of Andre's costs of living in terms of rent, food, etc., are covered by SSI, and then the programming and the paying of staff to be able to support him, those are Medicaid costs. So, just to point out two things. One is, as part of the SSI, the SNAP is part of that, which is food stamps, which Andre needs food stamps. So the thought of taking away SNAP to a person who cannot swallow is obscene, really.
Mm.
As far as the Medicaid, I just want to bring up the fact that if the federal government were to cut Medicaid substantially, well, it's going to be tough for Rhode Island Medicaid to make up the difference, because there's a match that needs to happen, and the budget in the state is not in such great shape now that they can sort of just pick up the difference.
Yeah, exactly. No, thank you, Will, and thank you for sharing Andre's story. I think first of all, it's important to remember and give credit to all the caregivers and family members who do so much and who are stretched so thin and would be stretched even thinner to the breaking point if it were not for Medicaid and SSI and SNAP. And you're right about the state budget implications. I mean, the way Medicaid works is the state sets the coverage, and in Rhode Island we have great coverage for Medicaid. The state sets the eligibility, who's eligible and who's not, and then there's a federal match. And if that federal match is cut, which is what we think is going to happen, then the state is going to face a terrible decision. They're either going to have to kick people off of Medicaid, reduce the services that are covered by Medicaid, or cut spending in other areas to try to preserve Medicaid or raise taxes, and it would be a truly impossible choice for state leaders to make at a time when, due to other factors, the state is already struggling in terms of the budget. So you're absolutely right. Finally, I want to hear from Michelle, the executive director from the Commission on the Deaf and Hard of Hearing. So Michelle, thank you.
Hello, Representative Magaziner. Thank you so much for this opportunity to meet with us. We really appreciate what you're doing, and it's an honor to be able to share how you're sharing the impact and how it's going to impact the deaf community with these cuts to Medicaid. Medicaid really gives access to language, which means access to life. Essentially, if a person doesn't have access to language, interpreters, or technology, or foundation for language acquisition at an early age, if those are not available to them, our life is going to be severely lacking. There's already a difficult time for us as a deaf person for me to access communication.
Yeah, sure.
It's a big enough challenge hearing from doctors, saying a doctor says, well, because of the cuts, I'm sorry, I can't provide access to you for communication. Imagine the deaf patients that can't afford interpreters anymore. We won't be able to provide access. That's already scary. There have been lawsuits that have been forcing medical providers and other providers to give access to communication. That's really going back to where we were. At the Rhode Island Commission on the Deaf and Hard of Hearing, we are really ensuring that people have that access, coordinating interpreters. We refer interpreters to doctors, organizations, agencies. That's part of our mandate that we're under. We're responsible to make sure that the deaf constituents have access. Access to communication will definitely lead to autonomy and inclusion.
Mm-hmm.
So that's very important to us. I personally I don't receive Medicaid. I had in the past, but currently I am not on Medicaid, but I can see how people of the deaf community do rely on it and how that's going to impact me in the future with my providers. Because if a person can't afford an interpreter now and they fight against that, how is that going to affect me in the future?
Right.
How are they going to be able to afford me and my care?
Mhm.
I've had experiences in the past where I didn't have an interpreter in person for one because I was having a surgery that was utmost important. And I ended up staying in the recovery room 5 hours extra without access to a communication. My husband is deaf as well. He was outside in the waiting room. He had no idea how I was. Am I dead or alive? Am I recovering? Because nobody communicated with him. So that's a huge concern, not only for myself as a deaf individual, but family members. Even early intervention, that's another concern of us for the deaf community. We want to make sure that the infants that are identified with hearing loss have early intervention access. And those families will get Medicaid to provide them access. How do they get access to language? It's an ongoing issue. If a child does not have that fundamental language, they are really going to suffer. And they're going to struggle emotionally, mentally, academically, for the rest of their lives. They're going to have ongoing problems because of that lack of access to language. If they have that foundation, they can do anything if they have that access to language from infancy. So I personally, I worked in the mental health care in the past. I've seen so many people who suffer and have suffered because of the language deprivation and what they've had to go through. So we strongly encourage that, having that constant advocacy for the access to language. And the state can't assume that cost. They just are not in a position to cover those cuts.
Yeah.
So if we can really talk about the access to communication means access to life for individuals of the deaf community.
Thank you very much, Michelle. And I think the theme that we're hearing in your remarks and really in everybody's is that, yeah, this is about autonomy. This is about, making sure that everyone has the maximum amount of freedom and agency possible so that people can work and contribute and all the rest. And, that's why, again, when I hear some of my colleagues say, well, that they want to cut Medicaid because they're worried or they believe that it makes people less productive to have government benefits, this is exactly the opposite. This is making people more productive by allowing people to have the care and the support that they need to work and contribute and all the rest. So I know it's been a lot of doom and gloom so far, and that is because the threat is very real. But I do want to conclude before we open it up for any questions that anyone else may have. Conclude with some hope, which is that I really do think that we can beat back these cuts. I really believe that. There are 220 Republicans in the House of Representatives. We only need 4 of them to stand up and say that they will not vote for a bill that includes cuts to Medicaid. We only need 4. And that is why myself, Jack, Sheldon, Gabe, House and Senate Democrats, we have all been talking about Medicaid every day till we're blue in the face, because we're trying to put that public pressure in place so that we can get those 4, hopefully more than 4, who are willing to stand up and do the right thing. And you're already seeing some cracks starting to show on the other side. You're already seeing some individual members and Republican members in both the House and the Senate who are saying, oh, we got to be careful about going too far on Medicaid. And so I think we're having an impact, but the next couple of weeks are going to be really critical. They are going to be coming out with this bill as soon as 2 weeks from now, and then trying to pass it before the end of May. So this is the critical time when we really need to be making as much noise as possible. That is why events like this are so important. So thank you all for participating. Is there anyone else who is here who has any questions or anything that you would like us to address? Does anyone around the table have any other thoughts to share?
So one of the things you were talking about, kind of the scenario of, okay, if these cuts come, what are the options? The state either has to look at reducing reimbursement rates or cutting Medicaid services in entirety. Those are really the only 2 options. And as a state, we don't have room to cut reimbursement rates anymore.
That's absolutely right.
We're already in a situation where our rates are so low that we have a primary care crisis. It has been on the news the last week or so. There are thousands of people that are losing their coverage because doctors won't work here because they don't even get paid enough by our Medicaid system to cover the basic costs of providing care.
Yeah.
It's been an ongoing issue. You know, now it's crossed over into primary care. Before that, it was the same issue with specialty care. One of the central aspects of my diagnosis is that I don't breathe well, and I need care from a pulmonologist, and I need equipment and breathing machines to keep me healthy and alive. And my pulmonologist retired, and I've spent a year trying to find another one, and I can't find another one.
Yeah.
I need to replace my machine, and I can't do that without a pulmonologist to write the script.
That's such an important point. Yes, absolutely. Like, we have a shortage of healthcare providers in this state, and it is getting worse, unfortunately. It is getting worse, not better. And so if Medicaid is cut further, then that provider shortage is just going to accelerate. And you're right, it's primary care, emergency, a lot of the specialties. And that'll happen no matter what the state's reaction is. Again, like, I think with Medicaid, if you compare Rhode Island to other states, we do well in terms of the percentage of the population that is eligible for Medicaid, because that varies by state. We do well there. We do well on the range of healthcare services that are covered compared to a lot of other states. We do not do well on how much we pay providers, and that is part of what is fueling this exodus of providers. That will only get worse. That will only get worse if these cuts go through, 100%. Any other thoughts?
I just want to say that Medicaid is actually a lifeline for individuals with disabilities. Without it, they're going to have poorer health outcome, and it's going to create a greater financial as well as emotional stress on their families.
Yeah.
So we really need to push back. This is the time for us to be loud.
Yeah, absolutely. And that's why, again, this is so helpful. Like, and if anyone else, any other ideas for anything else that we could be doing, let us know. But we are trying to make as much noise as possible here, back in Washington, online and social media. And that is increasingly important because that's where more and more people get their news from. And also because it is borderless. And so when we post things like this event on social media, it's not just people in Rhode Island who hopefully see it, but people in other states as well. But we gotta, this is the key time. So we gotta get the word out, like you said.
I think I'm Morna Murray from Disability Rights Rhode Island. We file lawsuits when people don't have access to interpreters, for example. But I think one of the things we really need to push, and I know you are, and I know other people are, and Will alluded to it, is how cost prohibitive it is for people to be institutionalized
Yes.
when they don't have proper services. The home and community-based supports that waiver that every state has now. I think around 2012 that began to outpace the spending on institutions, and we've made enormous progress in the last 12 years for people living in the community with disabilities. We would be going back to the dark ages if that were to be cut, because that's a waiver, that's optional spending, and that optional spending is the first thing to go when we have Medicaid cuts, as you know, in the state. I think, Allison and Christina and Andre's example are perfect examples of, having that support to be able to live in the community, work in the community, have your best life, like everyone else should. Everyone should. And also, Andre's example illustrates, I also wear the hat of a parent of a young adult with disabilities who is on Medicaid and SSI. And I cannot stress that the vulnerability that Will is talking about, how common that is, how easily young people are toppled when something is not in place for them. My son, for example, is currently in the hospital because of a huge disappointment he had in a job that led from one thing to another. His medications became out of whack and he couldn't function. That's something that, because he is so vulnerable as a person on the autism spectrum and with the mental health issues as well, without consistent care, without consistent quality care, he's subject to these things that then cost Medicaid hundreds of thousands of dollars.
Right.
And it's really so absurd.
Yeah.
You know, you want to appeal, and I've been doing this for a long time, and I've been a lobbyist. I don't currently a lobbyist, but I used to in a previous life. And, you know, you want people to respond to the right and wrong argument, but that doesn't always work,
Yeah.
as we all know. And we have to put it in dollars and cents. And the dollars and cents are off the charts,
Absolutely.
a clear-cut case for not cutting Medicaid.
Absolutely.
That
No,
880
you-
billion is not going to be saved in the long run.
No, and it's gonna cost more in uncompensated care at hospitals. It's gonna cost more to Social
Right.
Security. It's gonna cost. I mean, and you know that uncompensated care is ultimately paid through everyone's premiums. You know, who are on
Right.
private insurance, and so it costs everybody. Absolutely, that's a really good point.
Thank you.
Were you gonna say something else?
I do want to mention one of the things, your Lorna's son, Andre, as well. There are so many people who are deaf in a group home that have specialty care of the group home. The group home has everyone that can sign, the staff that can sign. Those people, though, they matter. These individuals are living in a group home that have access to their best life. And I'm just thinking, having this type of cuts means that we don't matter. Well, do we matter or do we not matter? If they cut the funding to Medicaid, does this mean that I don't matter? These individuals living in this group home with their best life don't matter?
Yeah.
We need to have people who are compassionate. It's not just compassion, it's seeing a person live their best life. It's actually, it hurts more than anything else to see people suffering like this.
Absolutely. Well, listen, I know these are challenging times, but I do think that the Republicans in Congress and the administration as well are susceptible to public pressure if it's loud enough and focused enough. And I hope that this will be the case here. But the best, most persuasive arguments I find are always personal stories. And so, to all of you, thank you for being willing to share your personal stories. I know it's not easy; it takes courage. But by doing so, I really believe that you're going to help lots of other people, and that we will be successful ultimately. Well, again, I want to thank you all. This is. While we conclude this event, this is not the end of the effort. This is, you know, we are in it now. So we'll be in touch with everybody here to find other ways that we can collaborate together to continue to get the word out and continue to keep the pressure on. I do ultimately think we're going to be successful. We just really need to dig in, especially these next few weeks. So thank you all for being a part of this,
Thank you.
especially on short notice.
Thank you so much.